some things in life that just fit. And I think when you talk about football, Thanksgiving, traditional rivalries, and being there, that's a good fit.
Today I have Bob Schwartz. He's a certified pit orthist, and he's going to be joining us for the Super Bowl Biomechanics Summit, February 7th. It's a virtual seminar, and I'm pleased that we're joining PFA to do this event, Bob, on February 7th, the Super Bowl Saturday. Brooks is sponsoring it. They're giving out shoes while supplies last to both pit orthists and podiatrists. Students are free. Welcome, Bob.
Thank you so much, Ben. Great to connect. Thanks for doing this. First of all, the program, and then keeping in front of everybody and keeping the mutual professions together. As a pedorthist, it's really a pleasure to share what we know and learn from each other through this process. So thank you again for that. We're going to be talking briefly about the why we look at footwear as part of the solution and the problem and the solution to most of the foot problems that we see as pedorthists.
And I love your catchy title, Footwear Forensics. It just explains it.
Well, thank you so much. It is about that, isn't it? It's about the history of a person, their recent history, living in a pair of shoes. Everyone walks into the office or the store with a worn pair of shoes. Almost everyone, you can tell the story from how they live their lives on the concrete or whatever their platform is they walk on. And so by looking at the shoes when they're on and looking at the shoes when they're off, gives us clues that really help shortcut to writing prescriptions for footwear, orthotics, and related devices.
I thought it would be fun to do a case series, and I went to the run event that you invited me to in Austin, and you had a segment, you had a little workshop, and I'm not going to steal your thunder. I'm just going to give you the clinical case of something I did, and you'll go through the photo and the video of the shoes and the gait. This was a woman that just had a baby, about 9 months, so the foot size expanded. As we know, with pregnancy, the foot size can expand with the ligaments laxing for the delivery of the baby. And she came in with right foot heel pain, a typical plantar fasciitis scenario that I confirmed with ultrasound to take a look at the fascia on that right side. Now, in addition, and before we get to the footwear forensic segment, when I did the exam, she was functionally longer on the right side, but also, I believe, anatomic, because when I had her supine, she was about a 1/4 inch longer on the right side. She also had a right shoulder drop and a right hip drop. Let's take a look at the shoes on the wear pattern of the shoes and tell me what you see, Bob.
So I'm looking at the shoes right now, and when you look at the wear pods, the medial side of the left shoe is worn significantly, even from the central to the medial side. Now, we know from all of the years of experience, plus all the studies done, that we want to be in a supinated position at heel contact. So you want to see a heel pattern just slightly lateral of heel, and here you see a central and medial. That is an immediate sign of a person who does not come from a supinated position, and so they're landing already pronated. If they're already pronated, which means the heel's is in valgus, then the medial side is collapsing, if you will. And we see that heel wear pattern. We know the foot is not going to be a good shock absorber because it needs to pronate to do that. So immediately we see in that picture that significance. When we look at the right shoe, we see much more of a normal wear pattern, even though you've got plantar fasciitis and you've got some pain and pronatory issues as well. At least they're going through some range of motion sufficient to land on the lateral side of the shoe. So you are dealing with that left foot and leg and hips, however it begins, as being a pathological issue because they're not being able to absorb shock on that side at all.
Now, any thought to my differential being that could be in the differential as an avoidance strategy, that she wore the lateral aspect of that shoe on the right side?
There may be a part of it, of course. We're always compensating for pain, so I would not dismiss it, but I would say that the right side, again, I don't see the full soul in a way that I can tell looking inside, outside. Things we'll do when we do our forensics on February 7th. But I would say that the heel area is at least closer to normal, and the other one is significantly abnormal. That's only as far as I could take this
Right. And you
particular.
mentioned there's a lot of complexities, hip range of motion,
Right.
knee, genu-valgum, all these things are part of the total puzzle in terms of keying in on just one factor of the footwear forensic wear pattern. But I like the fact that you brought up the insole, something I neglected to do in this particular case, and something that you reminded me to do. And sometimes, right, there's only so much you can do in one clinic visit, but we can certainly revisit that on her next visit, and also something I could look at with interventions. Now, in looking at her gait, what I noticed, she was pronating more on that left side when we look at the gait. Any comments?
I think when you land pronated, you're shot. And so you're landing on the medial side. You don't go really through. I'm just looking at it myself. And again, you're dealing with the genu-valgum component, which looks, again, the visuals that I see looks to be greater on the left than the right. And I'm always reminded of one case that happens to be me. And I've had a struggle with my right glute for all the years that I played competitive sports. It was always my weakness. And I do think that muscle imbalances become much not only chronic, but we compensate for them. And I think it's going to be what you said earlier about, compensating or consciously or unconsciously, but habitually. And then as the shoe wears out, which in this case it's well worn, that left shoe is not really wearable, it only exacerbates the problem rather than doing anything to help the problem because they're using, in this case, moderate density EVA foam, maybe 35 durometer is what it looks like. It might be more, but knowing some of the brands, it could be a soft enough foam that it's not going to hold long anyway. You need a more compressed foam if you're going to use foam where the compression sets probably at least 45 durometer. And you're going to find that with polyurethane and other materials. You won't always find that with EVA. So the footwear itself, in terms of its durability and balance and all those things, has to be looked at as well.
So I'm going to give you what my treatment plan was, Bob, and then you can comment on any things that you would do. And you already gave me some good points for the next visit is to look at glute strength, look at some of those parameters that you don't always have time to measure in that first interaction. She was wearing a Hoka. This is an example of something similar to a Hoka. And that was a 2-year-old Hoka, by the way. I went to something that was more of a trail shoe. And so for two reasons, you mentioned the EV, the outer sole breakdown. This happens to be a much sturdier Vibram outsole. And then something as we were talking here, you and I noticed that the counter, the back counter is reinforced and more stable than a typical in the same brand running shoe that isn't going to hold the heel. So that was just one component. I scanned her for a custom orthotic. I did a little bit more rear foot verum on the left side because of what I was observing in gait. And then I gave her some exercises, intrinsic exercises for the foot. So that's what I did. And that's a lot on the first visit to do all that. But there's certainly other things, I'm sure, if you have anything else that you on correction for that kind of scenario.
I like the firmer counter. I think that if you're writing a footwear prescription for everything we see here, I would even consider a high top because again, the more stable we can get her in the frontal plane where she's clearly unstable, the better we have a chance to bring the leg to the foot and the foot to the ground more evenly. So I like that prescription very much on the footwear. I would say that it probably is. Again, not having felt the patient directly, but it does look like more medial support needed on the left than the right. And I think stability and support is what you need the most here, even with the heel pain. I like the compression concept as well. Sounds like a good prescription.
And I love that you are on the forefront. You mentioned high tops. Uh, is there anything you can spill the beans on something that you're going to bring in your store?
And we've really actually been rebuilding our high top orthopedic and non-orthopedic high top business because we needed to have both for outdoor as well as just normal New York City walking. So you have a totally different look than when you're going on trails and things. So we've really just been rebuilding that inventory and very excited. We've got a new line coming from Germany and plenty more. We hope you guys get to Ennislow and experience us for yourselves. And I appreciate the time. Thank you so much, Ben.
Yeah, look forward to having you, Bob. Super Bowl Saturday, the Saturday before. And again, the early registration time and the time you'll be most likely to get the Comp Brooks shoes for paid registrants will be before December 22nd. That's the early bird, and then it's going to bump up $20. So you can go to the American Academy of Podiatric Sports Medicine. And I know Bob Laura Vargas is in the process of finalizing your CEUs for the pedorthists. But regardless of the credits, it's going to be a great learning opportunity to learn from two like specialties that approach things from a slightly different vantage point.